Your heart is pounding so hard you're convinced you're dying. Your chest feels like someone's sitting on it. You can't catch your breath. Your hands are tingling. The room is spinning. All you can think of is something is very wrong. I'm having a heart attack. So you rush to the ER. They run tests, EKG, blood work, chest x-ray. Everything comes back normal. The doctor says, you had a panic attack. Here's some Xanax. And you walk out thinking, that's it? Just take a pill and hope it doesn't happen again? I'm Dr. Air, quadruple board-certified integrative psychiatrist and lifestyle physician. Today we're breaking down what panic attacks really are, why they happen, how they're different from panic disorder, and the treatments that actually work, including the one medication mistake that keeps people dependent for years. I'll also teach you a breathing technique used by Navy SEALs that can stop a panic attack in 90 seconds. A patient of mine, Isabella, had her first panic attack at 44 while driving down the highway. Out of nowhere, her vision tunneled. Her heart felt like it was going to explode out of her chest. She pulled over, called 911, and genuinely believed she was having a heart attack. The paramedics checked her vitals, everything was normal. 2 weeks later, it happened again, then again. Then she stopped driving on highways altogether. Within 3 months, she was avoiding grocery stores, crowded restaurants, and even her daughter's school events. That's when panic attacks became panic disorder. Let me explain the difference, because most people don't know there is one. A panic attack is a single episode. It's terrifying, but it's temporary. Panic disorder is when you've had multiple panic attacks and you start living in fear of the next one. Your world starts shrinking. You avoid places. You cancel plans. You stop doing things you used to love. In some cases, panic disorder is associated with agoraphobia, which is fear or anxiety of using public transportation, being in open spaces or in closed spaces, standing in line or being in crowd, or being outside of your home alone. For many people, panic disorder gets worse if not treated. 6 months from now, you might be avoiding even more situations. A year from now, you might struggle to leave your house. Depression often follows. Substance use sometimes follows. Relationships strain under the weight of constant fear. But before I show you how to break that cycle, let me explain what actually happens during a panic attack. Think of your brain like a smoke detector. A normal smoke detector goes off when there's actual smoke. But in a panic attack, your amygdala, your brain's alarm system, goes off when there's no fire. Your body floods with adrenaline and cortisol. Your heart races. Your breathing becomes rapid and shallow. Blood rushes away from your digestive system and into your muscles, preparing you to fight or flee from a threat that doesn't exist. This is why panic attacks feel like you're dying. Your body's reacting as if you're in mortal danger, even when you're sitting in a meeting, lying in bed, driving, or standing in line at a grocery store. Your brain can't tell the difference between a panic attack and actual danger. To your amygdala, both situations look identical. So every time you have a panic attack, your brain files it away as evidence that the world is dangerous. This creates a feedback loop. You become afraid of having another panic attack, which makes you more likely to have one. Now let's talk about the symptoms, because recognizing what's happening is the first step to stopping it. During a panic attack, you might experience racing heart or palpitations, chest pain or tightness, shortness of breath, or feeling like you're choking, dizziness or feeling faint, tingling or numbness in your hands or face, sweating or chills, nausea or stomach distress, a sense of unreality like you're watching yourself from outside your body. And the most terrifying symptom, the overwhelming fear that you're dying or losing control. Most panic attacks peak within 10 minutes, but those 10 minutes can feel like an eternity. So why do panic attacks happen in the first place? There are 3 main drivers. Number 1, a nervous system stuck in overdrive. Think of your nervous system like a car engine. It's supposed to rev up when you need it, then idle back down when the threat passes. But when you've been under chronic stress for months or years, work pressure, financial strain, relationship conflict, caregiving responsibilities, your engine gets stuck in high gear. This becomes more common as we get older, especially for adults juggling decades of accumulated stress. Number 2, hormonal shifts. For women, panic attacks often worsen during perimenopause or menopause, when estrogen and progesterone fluctuate wildly. Estrogen helps regulate serotonin and GABA, your brain's calming neurotransmitters. When estrogen drops, your nervous system becomes hyperactive. But men aren't immune. Declining testosterone and rising cortisol can also trigger panic symptoms. Number 3, metabolic dysfunction. Your brain runs on glucose and oxygen. When blood sugar crashes, your brain perceives it as a threat and triggers a panic response. Insulin resistance, low blood sugar, dehydration, caffeine overload, poor sleep, or inflammation can all prime your nervous system for a panic attack. Now, let me teach you that breathing technique I promised. It's called box breathing, and it's one of the fastest ways to stop a panic attack in its tracks. It's simple, it's powerful, and it works fast. It's called box breathing because each step is the same length like the 4 sides of a square. Also known as tactical breathing, it involves 4-4-4-4 pattern. Inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. This rhythm activates your vagus nerve, the main highway between your brain and body that controls your parasympathetic nervous system. Think of it like hitting the emergency brake on a runaway train. Within a few seconds to minutes, your heart rate slows, your blood pressure drops, your body gets the signal, we're safe. I've seen this work in real time with patients who thought nothing could stop their attacks. Now let's talk about treatment, because this is where most people get stuck. Your doctor probably prescribed a benzodiazepine like Xanax, Ativan, or Clonopin. These medications work fast. They calm your nervous system within minutes. But here's the problem. Benzodiazepines are like putting a Band-Aid on a broken bone. They're only meant for short-term use, a few weeks at most. Why? Because your brain adapts to them quickly. You build tolerance. You need higher doses. And when you try to stop, withdrawal can be brutal, sometimes worse than the original panic attacks. Long-term benzodiazepine use is also linked to memory problems, increased fall risk, and addiction. So what's the better approach? The gold standard treatment for panic disorder combines 3 things. Number 1, cognitive behavioral therapy, specifically CBT with exposure therapy. CBT teaches you to recognize the thoughts that fuel panic and challenge them. Exposure therapy gradually reintroduces you to the situations you've been avoiding, retraining your brain to recognize that they are safe. Studies show CBT is as effective as medication and the results last longer. Number 2, antidepressants, specifically SSRIs or SNRIs. Medications like sertraline, escitalopram, or venlafaxine help regulate serotonin and norepinephrine, stabilizing your nervous system over time. Unlike benzodiazepines, these medications don't cause dependency and actually prevent future panic attacks. They take 4 to 6 weeks to work, but are much better long term. Number 3, integrative and lifestyle medicine. This is where most conventional doctors stop, but it's where the real healing begins. We look at the whole system: hormones, inflammation, gut health, mitochondrial function, blood sugar regulation, and nervous system resilience. For Isabella, we didn't just prescribe an SSRI and send her to therapy. We checked her hormones: estrogen, progesterone, testosterone, and thyroid. We did micronutrient testing, including vitamin D, B12, folate, and red blood cell magnesium. Many were off. We stabilized the blood sugar by adding protein to breakfast and eliminating the afternoon caffeine crash. We added magnesium glycinate and omega-3 fatty acids to calm her nervous system and reduce inflammation. We taught her box breathing, which she did every morning and whenever she felt an oncoming panic attack. Within 8 weeks, something remarkable happened. Isabella drove on the highway again. She went to her daughter's school play. She stopped scanning every room for exits. She told me, "I feel like I got my life back." Not everyone needs medications, but SSRIs can be game changers for some. To find out more about the most commonly prescribed medication for anxiety, check out the next video.